To determine if an ECG report is normal, it should show the heart's normal electrical activity without any signs of heart conditions or abnormalities. Checking an ECG report can be a bit challenging, but dividing it into smaller sections can make it easier to understand. First, check the heart rate. A normal heart rate for an adult ranges from 60 to 100 beats per minute. Next, examine the heart's rhythm, which should be steady with consistent intervals between each beat. Then, look at the P wave, which represents the electrical activity of the atria and should be smooth and uniform in shape, present before every QRS complex. The QRS complex, representing the ventricle's electrical activity, should be consistent in size, duration, and shape, and narrow. The ST segment, showing the time between the QRS complex's end and the T wave's beginning, should be a flat line at the same level as the baseline. The T wave, representing the electrical recovery of the ventricle after contraction, should be upright and consistent in size, shape, and duration. Finally, check the QT interval, the period between ventricular constriction and recovery, which should fall within the normal heart rate range based on the individual's heart rate. By checking these components, one can easily determine if an ECG report is normal. A normal ECG report will have all these characteristics, indicating a healthy heart with no signs of conditions or abnormalities.